Good day, ma'am. I'm your student nurse. My name is Angelo Gabriel Fabio Simon, and today I'll be performing a physical assessment. So, can you please state your first and last name?
I am Sherina Alejo.
Sherina Alejo. Let me see. Your age
I am 20 years old.
and your birthday.
It's December 28, 2001.
So, before we start, I have here some few questions for your physical assessment. Are you aware of the date today?
Yes, it's June 13, 2022.
Okay, that's good. Are you aware of where we are today?
We are in hospital.
Okay, that's fabulous. Do you experience any problems with your skin
Nothing.
and your hair?
Nothing also.
And how about your vision?
Nothing also.
And how about your stomach?
Wala din po.
Wala din po. So, before we start, I'm gonna ask you, what language are you most comfortable to speak with? Is it okay if we just do it in a mixed language of Filipino and English?
Yes.
Okay, it's good. And rest assured that all this information are kept with utmost confidentiality, and only the nurse and the physician will be the one who can see your information. Okay, thank you. Okay, so let's first do the assessment on the eye and vision. Can you move your eyebrows up, down, up, and down? Okay, that's great. Our patient's eyebrows, the hair is evenly distributed. The client's eyebrows are symmetrically aligned and showed equal movement when asked to raise and lower the eyebrows. And for eyelashes, and our patient's eyelashes appear to be equally distributed and curve slightly outward. Okay, so let's next the eyelid. Pwede mo ang ipilitin yung mga mata. Yan. And tingin po sa taas. Sa baba. Sa taas. Baba. And so our patient's eyelids, there were no presence of discharge, no discoloration, and the lids closed symmetrically with involuntarily blinks when asked. So our next assessing is our patient's eye. Sundan niyo po yung mata niya, sundan niyo po yung kamay ko, Okay, that's great. Our assessment of our patient's eye, the bulbar conjunctiva appeared transparent with few capillaries evident. The sclera appeared white. The purpural conjunctiva appered shiny, smooth, and pink. And there is no edema or tearing of the lacrimal gland. And cornea is transparent, smooth, and shiny, and the details of the iris are visible. The client's blink with the cornea was touched. The pupils of the eye of our patients are black and equal in size. The iris is flat and round, and pupils constrict when looking at near object and dilate at far object. And pupils converge when object is moved toward the nose. And when assessing the peripheral visual field of our patient or our client, the client can see object in the periphery when looking straight ahead. And when testing for the extraocular muscle, both eyes of the client coordinately move in the unison with parallel alignment. The client was able to read the Snellen chart at the distance of 10 feet. So let's now proceed to the integumentary assessment. with the skin, hair, and the nails. So let's first check the hair. Okay, that's great. Our patient's hair is thick, silky, and is evenly distributed and has a variable amount of body hair. There are also no sign of infection and infestation observed. And our patient's skin is uniform in color, unblemished, and no presence of any foul odor. And she has a good skin turgor, and skin temperature is within normal limit. And with the nails, and we are also performing the blanch test. The client's or our patient's nail is pink in color and has the shape of convex curve. It is smooth and is intact with the epidermis. When nails are pressed with our blanch test or the test that we did, the nails return to usual color in less than 4 seconds. So let's move to the head assessment of our client. So our assessment on our client's head, the head is rounded, normocephalic, and symmetrical. And the skull, there are no nodules or masses and depressions when palpated. And for the face of our client, the face appeared smooth and has uniform consistency and with no presence of nodules or any masses. So our next assessment is our client's ear. So let's check first. So our assessment on our patient's ear, ears are equal size bilaterally and no swelling nor thickening. And our patient's ear are intact. As you can see, there's no lumps or lesion. And also, we observe that there is the Darwin's tubercle is present. So we are now performing the assessment of the ear internal structure with the use of the otoscope. We can now view the internal structure of our client's ear. Okay, so based on our assessment, there is no redness, swelling, or foreign body present inside the structure of our client's ear, and a small amount of there is no odorless, there's no amount of odorless, and there is no any serum or earwax present. So we are now on the assessment of our patient's hearing acuity. So patient responsive. Based on our observation, our patients respond to the verbal stimuli, and patients correctly repeat what is being whispered to both of her ears. Patient is also able to detect the sound of a ticking watch on both ears. The auricles are symmetrically and has the same color with the facial skin. The auricles are aligned with the outer canthus of eye. When palpating for the texture, the auricles are mobile, firm, and tender. During the assessment of the watch tick test, the client was able to hear ticking in both ears. So now we are on the part of the assessing our patient's nose. So, okay, let's do it. So our assessment of our patient's nose, the color is the same as the rest of the face, and the nasal structure is symmetric, and the nasal structure is also smooth, and when being touched, pinched, there is no tenderness. So we are now on the procedure of checking the airflow through nostril of our patient. So we are now doing it in checking the airflow through the nostril. One nostril at a time will do, and we are going to ask the patient to sniff, and we will going to feel the flow of the air and also the inflow and the outflow of the air on our patient's nose. So okay, on the other side. Okay, good. So our patient is able to sniff through each nostril while the other is oculated. Okay. So we are now going to perform the assessment of the sinuses. Ayan. Clear. Okay, thank you. So our assessment, the frontal sinuses are non-tender to palpation. There is no crepitus in our observation, and also on the lower part, maxillary sinuses are non-tender to palpation, and also there is no crepitus that is evident or can be seen. So we are now on the part of assessing our patient's mouth and gums and teeth. So can I look the lower lips? Can you please open your mouth? Pwede bang gawin yung mag-whistle? Okay, that's great. Okay, thank you. So in our assessment of our patient's mouth, the lips of the client of our patients are uniform in color, which is pink. It is moist, symmetric, and have a smooth texture. So when our patient asked to purse his lips, she was able to do so, and she was also able to whistle. And about for the teeth and the gums, there are no discoloration of the enamels, no retraction of gums, pinkish in colors of the gums, and the mucosa of our client appeared as uniformly pink, moist, soft, glistening, and with elastic texture. So now we're moving on the innermost part of our client's mouth using a tongue depressor and our flashlight, pen light. Say Okay, all good. So the tongue of our patient is centrally positioned. It is pink in color and moist and slightly rough, and there is a presence of thin whitish coating. And as the smooth palates are light pink and smooth, while the hard palate has a more irregular texture. And the uvula of our client is positioned in the middle of the soft palate.
Our final assessment is that we found no signs
or any problems of our patient's physical assessment. Overall, our patient is healthy.